Hello, everyone. So, have you ever been to a developing country? Have you ever been exposed to a hardship of a struggling community or experienced giving hands on medical care? Are you aware of the global epidemics that majorly impact populations every day? Today, many of the challenges populations face revolve around deprivation of proper medical care, exposure to fatal infectious diseases, limited resources to fight the fatal brutalities, and misunderstandings of the true problem at hand. Today I'll be talking about affordable health care, nonprofit work, and mission trips. Many nonprofits are working to implement affordable health care, insurance, and emergency services in the DR. So there are two-tier governments sponsored for free care in the DR, so these help with new innovative processes and alignments with other organizations. Santo Domingo, first-rate private hospitals and clinics with top-notch technology and amenities. Now, there are many key tourist areas that are key to high-class facilities, but as soon as you go outside of those tourist communities, you're going to go into like different hospital organizations that just don't have a lot of proper care. Now, we see that healthcare in regions outside of the capital are struggling. So there's not really a lot of proper emergency services. It was stated that there is one public facility in each province of the country. This is a little concerning when there are so many people around the whole region of the DR and not just in the main capital area. This was stated by Live and Invest Overseas article. Now, we look at how nonprofits work to improve maternal and child healthcare outcomes. So this is reducing neonatal mortality and also addresses emerging healthcare needs in society. One important organization that has worked to do this very strongly and very prominently is Project Hope. Project Hope has the mission of improving the capacity of healthcare professionals and procuring essential equipment for neonatal survival. So there was one quote that I found that talked about how we are also revitalizing one of Hope's signature programs. So this is the Monte Plata, and this will actually help to reinforce all the rehabilitation centers for these neonatal babies, which is super exciting and very, very crucial. Secondly, we see Empower 15 Women as Leaders and Improve Health of 600. So this nonprofit is working to help with poor education, a lack of running water, inaccessible medical care due to dangerous improved needs, roads, and results. And many residents are suffering from unnecessary illnesses and sicknesses and injuries. So Project Empower 15 has really helped to revamp the whole situation in the DR. Thirdly, we see how mission trips are structured to help struggling communities. So I myself have been to the DR on a mission trip, and through this it was for Spanish and healthcare immersion. And so I worked for basic necessities like hand washing, knowing how to brush your teeth, just like the basic necessities that do ultimately change a whole person's scope on life. We see how there's international medical relief. So this is how I kind of plan to study public health. So I want to really focus on domestic healthcare policy, international health and resource allocation, both in the Omaha community and abroad after my 4 years at Creighton. And secondly, we see how IMR will be traveling to villages surrounding the provinces. So really the provinces will have one main healthcare facility, but we want to branch those out and really see how we can really improve the overall healthcare spectrum. And that all starts outside of the main capitals because that's where a lot of people are in desperate need of healthcare. And so we see how these dental services, education, and medications is really making a difference in all these people's lives. And another way that the mission trips have been helping is volunteering in the DR. There's a lot of organizations, not only through Creighton, but like Rustic Pathways, so many different organizations that students can get a part of to truly make an impact. And this is through community initiatives, school-based programming, and really taking the dedicated time to help these locations. So today, we talked about working to implement affordable, attractive healthcare in the Dominican Republic, along with health insurance and emergency services. Secondly, we talked about how nonprofits are working to improve maternal and child healthcare outcomes, reduce neonatal mortality, and address emerging health needs. And lastly, we talked about how mission trips are a great way to get involved with a relief to help struggling communities, since health is a major concern for many regions in the DR, but also around the world. Thank you so much for your attention. I hope this inspires you to help the healthcare industry in third world countries, but also in your local community.